Hello, my name is Dr. Sadaf and I will be performing the lymphoreticular examination on Dr. Kamran today. Hello, Dr. Kamran.
Hello.
I will be examining some glands in your neck today and also in your tummy. Is that alright?
Yeah, that's alright.
Okay, if that causes any pain or discomfort, please do let me know.
Okay.
Starting with the cervical lymph nodes, I'll ask the patient to relax his neck. Please, if you could look down a bit. So examining the submental, submandibular, the jugular-digastric, the anterior cervical chain in front of the sternocleidomastoid. If you could please shrug your shoulders for me, the supraclavicular lymph nodes, and relax. The posterior cervical chain, the preauricular, the postauricular, and the suboccipital lymph nodes. So there is no lymphadenopathy in my patient. If I could please ask you to stand up for me. Moving on to the axillary group of lymph nodes. For that, I will ask the patient to cross his right limb over my right limb and palpate with my opposite hand. So going for the anterior axillary nodes, the medial, and the apical all the way up, and then if I could relax your arm, and the lateral along with the humerus. Thank you very much. If you could cross your other arm over my left arm, and with the opposite hand, the anterior group, the medial group, and all the way up the apical. And if you could relax a bit, and with the same arm, the lateral group against the humerus. Thank you very much. If you could fold your arms like that for me, and for the posterior group we will go to the back and behind the axilla. So no axillary lymphadenopathy seen in my patient. Now if you could please have a seat on the couch and lie down for me. On inspection in the lymphoreticular examination, you do general examination for any leukemias or any other lymphoreticular abnormalities. We check for any ear infection, any discharge, any nasal crusting, any alopecia, and ideally we would do a thymus. For the thymus we will do a CT scan of the neck, and something to be examined now. If you could put your arms by the side. Spleen and liver are important aspects of the lymphoreticular examinations. I will be gently palpating your tummy. If you feel any pain or discomfort, please do let me know. And if you could please take deep breaths for me. So palpation from down, and from the second rib you need to percuss the liver. So you can feel the dullness here, and the liver span is normal, which is 10 centimeters. For the spleen we will go diagonally, so keep on taking deep breaths. The splenic notch cannot be felt. If you could please turn over towards me. And you could do a thrust to actually feel the spleen below the ribs. And no splenomegaly is seen in my patient. For abdominal lymph nodes we would like to do a CT scan as well, ideally. So after doing the abdominal examination, we will warn the patient and also palpate for the inguinal lymph nodes, which are in the inguinal region. And we can also do an abdominal CT for the intra-abdominal group of lymph nodes. Okay. Moving on to the lower limbs, I'd like to palpate the popliteal group of lymph nodes. So if I could please bend your leg, placing the thumbs on the patella and going deep to in the popliteal fossa to palpate for the lymph nodes. And doing the same on the other leg. So the popliteal lymph nodes are not palpable. If I could please have your arm, relax the patient's elbow, feel with both your thumbs for the cubital lymph nodes here, and ask him to relax the other side. So you could feel for the epitrochlear above the elbow. And doing the same on the other side. So cubital with both your thumbs in the cubital fossa, and ask the patient to relax, and epitrochlear above the elbow. Thank you very much. That concludes our lymphoreticular examination. Hope you enjoyed and benefited from the video. Thank you.